Hello everyone. In today's class, we'll be talking about medical management of hepatitis B. So basically, in this class, I'll be talking about hepatitis B infection and the immune response, drugs which are used for the management of chronic hepatitis B, including antivirals and interferons, treatment for chronic hepatitis B as per the national guidelines, selection of antiviral drug for the patient with chronic hepatitis B, and when to stop the treatment. So basically, starting from the infection and the immune response. So it has been seen that if any patient is developing hepatitis B infection, acute hepatitis B infection, the body has a robust immune response. What is the meaning of that? इसका मतलब ये है कि जब पेशेंट को acute hepatitis B का इन्फेक्शन होता है तो हमारा इम्यून सिस्टम बहुत अच्छे से काम करता है, एक बहुत अच्छा रिस्पॉन्स होता है हमारे इम्यून सिस्टम का. एंड बिकॉज ऑफ दैट गुड एंड रॉबस्ट इम्यून सिस्टम व्हाट हैपेंस, द एंटीजेंस और द वायरस इज क्लियर्ड ऑफ फ्रॉम द बॉडी. ठीक है, जो फाइट रिस्पॉन्स है हमारे इम्यून सिस्टम का एंटीजेंस के लिए या फिर वायरस के लिए, वो इतना स्ट्रांग है दैट इट विल बी एबल टू क्लियर ऑफ द virus from the blood or from the body. So the treatment is not required as such. But when we talk about the chronic infection means the infection is there since a long period of time. It's been months now. It's been more than 6 months now. The immune system is also tired. ठीक है, हमारा immune system भी जो है वो थक चुका है. So there is impaired immune system, and because of which the body or the immune system of the body will not be able to clear off the virus from the blood, from the body. इसीलिए we need to provide the management, we need to provide the treatment. So from this slide, you have to remember any patient who is having acute hepatitis B infection will not be requiring the therapy, will not be requiring the treatment because immune system is activated and it will be able to clear off the virus. उस टाइम में क्या चाहिए? उस टाइम में चाहिए the symptomatic management, the conservative management, good hydration, balanced diet, or if a person is having pain, analgesics for that. If a person is having fever, management for that. If there is nausea, vomiting, management for that. So basically, symptomatic management will be done. But if any patient is having chronic infection, yes, the medical therapy is required for the patient. Now the next thing is, what is the medical therapy? ठीक है, कौन सी ड्रग्स यूज करनी है? सो वी हैव टू ऑप्शंस, वन इज एंटीवायरल्स एंड वन इज इंटरफेरॉन्स. सो when we talk about the comparison of antivirals with interferons, it has been seen that the antivirals examples are nucleoside analogs. We'll talk about the examples of these nucleoside analogs, but when we talk about antivirals, you can see in the picture, they are good viral suppressors, but they are poor immunomodulators. Okay, जो हमारे ड्रग्स है वो इम्यूनोमॉड्यूलेशन इतना अच्छे से नहीं कर पाएंगे जितना अच्छे से वायरस को सप्रेस करेंगे. On the other hand, when we talk about interferons, they are poor viral suppressors, but they are good immunomodulators. So this is the difference between both of them. Before I go further, in my next slide, I would like to just tell you one thing about hepatitis B, that इस वायरस के दो पॉइंट्स हैं. एक पॉइंट है पॉजिटिव, एक पॉइंट है नेगेटिव इस इन्फेक्शन की. ओके, सो पॉजिटिव पॉइंट क्या है? दैट वी डू हैव अ vaccine available. 1982 onwards, we do have a hepatitis B preventive vaccination available, and with those 3 doses, the person can be like, it is protective for the patient to have the hepatitis B infection. तो एक बहुत पॉजिटिव बात है कि हम इस इन्फेक्शन को प्रिवेंट कर सकते हैं with the help of vaccine. Now comes the negative point. Negative point is that we do not have a cure available for this infection. It means with the interferons or with the antivirals, we can modulate the immune system or we can do the viral suppression, but completely the virus is like, we may not be able to completely clear off the virus from the body. This is something which is a negative point which with this infection. So as per the guidelines, the national guidelines, what is the treatment of choice for a patient with chronic hepatitis infection? So guidelines के हिसाब से there are 3 drugs which can be used for the management. I know in different centers different other medications are also used, but I'm just teaching you what is the recommended guidelines. So उनके हिसाब से any patient who is having the chronic hepatitis B infection, they might be treated with any of these medication. कौन कौन सी medication है ये? It is TDF. TDF is tenofovir disoproxil fumarate in the dose of 300 milligram OD once a day. Then we have one more type of tenofovir, which is your TAF, that is tenofovir alafenamide fumarate. The dose is 25 milligram OD. Okay, दोनों की indication, contraindication are different. The third drug is entecavir. Okay, entecavir की dose जो है, it ranges between 0.0 milligram OD to 1 milligram OD. तो 3 drugs हैं. One is your tenofovir disoproxil fumarate. Second one is your tenofovir alafenamide fumarate. The third one is your entecavir. Depending on patient to patient, on case to case basis, the physicians are deciding which drug is going to be more effective or which drug is indicated for a particular patient. आपको क्या याद रखना है? कोई भी patient जिसको compensated liver disease है, उसको entecavir आप 0.5 milligram देंगे. जिस पेशेंट को डीकॉम्पेंसेटेड लिवर डिजीज है उसको एंटाकाविर आप डबल डोज देंगे, दैट इज 1 milligram. नाउ व्हाट इज द डिफरेंस बिटवीन कॉम्पेंसेटेड एंड द डीकॉम्पेंसेटेड लिवर डिजीज? सो बेसिकली compensated liver disease में क्या होता है? The person has liver disease but do not have the active symptoms of liver disease. But when we talk about the decompensated, it is the severe one where the person has a liver disease. With that, he also has the active symptoms like there might be GI bleeding, there might be portal hypertension, there might be hepatic encephalopathy, there might be ascites, etc. Okay, the list goes on. So ऐसे पेशेंट को जिनको कॉम्पेंसेटेड लिवर डिजीज है बिकॉज दे आर स्टेबल देन द वन हु आर डिकॉम्पेंसेटेड, उनको आप 0.5 milligram दोगे, और जिनको डिकॉम्पेंसेटेड है उनको आप 1 milligram एंटीकाविर दोगे. देन यू हैव वन मोर टर्म रिटन हियर, lamivudine. So अगर आपको याद होगा, just I told you in many centers the type of treatment is different. Many centers the lamivudine is used. ठीक है, तो lamivudine का क्या है main जो adverse effect है या main जो the issue with lamivudine is that it is causing resistance. ठीक है, इससे drug resistance काफी ज्यादा है. तो कोई ऐसा डिजीज जो लाइफ लॉन्ग के लिए रहता है एंड द ट्रीटमेंट इज रिक्वायर्ड फॉर लाइफ लॉन्ग, अगर आप उसे ऐसी मेडिकेशन दोगे विच हैज अ हाई ड्रग रेजिस्टेंस, तो क्या होगा? इट विल नॉट बी गुड फॉर द पेशेंट, राइट? इसीलिए गाइडलाइंस के हिसाब से lamivudine इज नॉट अ पार्ट ऑफ दैट, बट इन मेनी सेंटर्स इट हैज बीन यूज्ड. Any patient who has been treated with lamivudine previously would not be preferred to be given entecavir. Okay, but if you are giving it, if the person is lamivudine naive मतलब उसमें कभी भी lamivudine नहीं यूज किया था, उस पेशेंट को आप एंटीकाविर दोगे कितना? 0.5 milligram OD. Next comes which drug has to be selected for the patients who are having the chronic hepatitis B infection. So when we talk about tenofovir disoproxil, it is preferred among the women of childbearing age and patients who were previously exposed to the lamivudine. जिन patients को पहले lamivudine दिया था उनमें आप prefer करोगे, और दूसरा those women who are in the childbearing age उनमें भी आप tenofovir disoproxil जो है TDF जो है वो prefer करोगे. Coming towards the entecavir, it is recommended in children more than 2 years, but between 2 to 11 years age, and more than 60 years age individuals also. And remember, the entecavir is not recommended in the pregnancy. The third one is tenofovir alafenamide fumarate, TAF. Basically, patients who are having reduced renal function, bone disease or bone toxicities, उनमें आप tenofovir alafenamide prefer करोगे as compared to the tenofovir disoproxil. उनमें आप एंटीकाविर भी दे सकते हो, बट एनी पेशेंट हु इज हैविंग रिनल डिजीज, बोन डिजीज, आप tenofovir disoproxil नहीं देते हो. सो बेसिकली एंटीकाविर इज प्रेफर्ड ओवर tenofovir disoproxil fumarate if the age is more than 60 years, if there is any bone disease, or if a person is having the altered renal function. Okay, so these are the medications which can be given depending on the case-to-case basis. The next question is, when should we stop the treatment? कब तक लेना है patient को medicines? Answer is, any patient who has got the hepatitis B infection along with cirrhosis should not discontinue the antiviral therapy. ठीक है, we have talked about it कि जो infection है ये lifelong रहता है. If it is a chronic hepatitis B infection, chances of relapsing, reoccurrence are common, reactivation are common. तो कोई भी patient जिसको hepatitis B with cirrhosis है, the antivirals should not be discontinued. Discontinuation may be considered among those patients who do not have cirrhosis and who have different kinds of modalities, like depends on case to case basis. Physicians are deciding कि उनको they want to stop or not, depending on if there is HBs antigen loss after persistent treatment of more than a year, or if there is seroconversion, or if there is HB antigen loss. Depending on various factors, they will be deciding in this person, the treatment can be discontinued or not. But any patient who has got the hepatitis B along with cirrhosis, it is recommended that they should not be, the antiviral therapy should not be stopped. And these patients will be also required lifelong follow-ups. They might be called after every 3 months, 6 months, 9 months, 1 year, depending on them, depending on their severity of illness. But yes, these patients will be monitored lifelong. So that's it for today's class. I'll just give you 2-3 questions at the end. You have to write down the answers in the comment box, and then in the next class we can just discuss about the answers of those questions. So basically you have to answer the answer in the comments. Why lamivudine is not a drug of choice for patients with chronic hepatitis B infection? We talked about it. Okay, कि हम lamivudine use करते हैं, but why it is not a drug of choice for those patients who have got the chronic hepatitis B infection? The next one is, which drug is used for the patients who have been exposed to the lamivudine? ऐसे patient जिनको पहले lamivudine start हो चुकी थी, पहले हुई थी, now which drug should be preferred for these patients? So that's it for today. Thank you so much.